All right, we'll get going and begin on this info session. Welcome everyone to the online Bachelor of Science in Public Health information session. Today, this event, you'll be hearing from our program director, where she'll be chatting more about our program highlights and more in detail about what the curriculum entails. Additionally, you'll be hearing from me when I'm speaking on behalf of those admission requirements that we have, and then our tuition and fee breakdown. If you do have any questions throughout this presentation, if you can go ahead, either raise your hand and then I'll be able to unmute you, or you can just put it in the chat and we'll be able to answer your questions as well. Today, you'll be, of course, hearing from me, Samantha. I'm an enrollment service advisor, and then Regan Johnson, our program director. And you'll actually be hearing from her in the next slide, where she'll be talking more about our program.
Hey everyone, can you hear me okay, Samantha? All right, great, awesome. Thanks for attending tonight. As Samantha said, my name is Regan Johnson. I serve as the program director for the undergraduate public health program. And just to give you a little bit more information about me, I also serve as a faculty member in the program. So I teach some of the upper level 3,000 and 4,000 level courses, as well as overseeing the internship for the program. And previous to this role, I worked in the field. So what's really exciting about our program is we have a lot of faculty members that have worked in public health and are now bringing their experience to our program. My experience was that I actually worked in higher education. So I worked in campus health and wellness, where I developed campus wellness initiatives to keep our students healthy and address health-related issues for college students previous to serving in this role. So I did that for about 10 years before coming to the program as a faculty member. So to give you a little bit of information about our program, what's really exciting about the public health program is there's a lot of opportunities to do public health work. You know, the idea is that public health professionals work to, prevent disease, prolong life, and protect the health of the people in the communities that they work. So there's a lot of opportunities to do that, whether you want to address maternal child health issues or address nutrition issues in a community. Maybe you want to focus on, where there may be food deserts where people don't have access to food, or addressing access to healthcare services. So a lot of opportunities to work in a variety of settings, from health departments to companies where you might be doing employee wellness, or health and human services organizations, centers for disease control, nonprofit organizations. So a lot of places that you can end up working as a public health professional. So as far as our students, when our students start in our program, we have a lot of support for them. We have an academic advisor that works directly with our students to really help them identify the coursework that they need to take each semester. And then we also have a student success coordinator, which works with students to really make sure they understand processes related to the university and just maneuvering things like financial aid and other types of university processes. So both of those individuals work very closely together with our students to make sure that they have their needs met. And as far as there's definitely flexibility with our program. We have some students that do the program full-time. We have others that do the program part-time, and students can start any semester. So fall semester, which is August timeframe, spring semester, which starts in January, or our summer semester, which starts around mid-May. And our courses are, when students take our classes, they are asynchronous, meaning that you can work on your coursework when it's convenient to you, but also having access to faculty members that, that have office hours or are accessible via email, as well as virtual meetings. Happy to meet with students to help along the way as they're working through the program. So as far as the curriculum goes, there are quite lots of courses that our students take. We also have a really flexible curriculum related to what you might bring in from other universities that you've gone to, but you have what we call our BSPH, our Bachelor's in Public Health core courses that you take, as well as some general education requirements that the university requires. And then there are lots of elective options for you to take. So this is where you might be able to take some courses that really interest you. So public health is a broad field with lots of opportunities, which is why we encourage students to take courses that may help them maybe specialize a little bit more. So if you're interested in nutrition, you can take some nutrition courses, or if you're interested in working in the healthcare setting, you can take some courses that are related to healthcare. And then we also have this culminating experience so that all of our students at the end of the program, they do an internship. And this is where the students, we will help you along the way, but you get to choose where you do your internship based on your interest and where you want to work. And so the program works with you to make sure that you find something that meets your needs and will help you be able to use the skills and knowledge that you've had in the course in the classroom. So a few of the courses that I want to highlight from our program are some of our more skill-based courses. So one course, it's called Program Planning, Implementation, and Evaluation. And this is a course where you actually get to learn about how do you assess the needs of a community, develop interventions to help meet those needs, and then evaluate those to make sure that you're actually make a difference in your community and the health outcomes are that you're increasing health outcomes. And then another one that is somewhat related to that is called Social and Behavioral Foundations of Public Health. And in this course, you're really learning about how do you get people to change their behavior. So what kind of messages, what kind of interventions will help them make behavior change. And then the one I've already talked a little bit about is our internship course. And so I do oversee internships for our students, but this is a time when our students are getting hours in the field and they're reflecting on that experience so that you, not only when you leave our program, do you have the skills and the knowledge, but you also have this experience that you can showcase as well.
Awesome. Thank you, Regan. I'll just touch base on those admission requirements that we have. If you're coming in as a first-year student where you have no past college experience, that GPA requirement will be a 2.7, and we'll also need to have your high school transcript sent to UC admissions. Additionally, if you are a transfer student coming from a previous college, that GPA requirement is a 2.0, and we would have to receive every past college transcript that you've attended in the past. Additionally, we do accept up to 90 semester credit hours from an accredited institution to be transferred into and applied to the program. And to reiterate what Regan mentioned before, so with our academic calendar, we are currently accepting students for the spring semester. The application deadline is November 15th, with classes beginning January 9th. And then we're also accepting applications for the summer semester, with the application deadline being March the 13th, and then classes beginning May 8th. The spring semester, spring 2023, the application fee is waived. And then the cost to enroll in this program will really dictate where you reside and if you'll be attending at a part-time or full-time rate. For instance, if you're an Ohio resident and you attend part-time, which is taking 3 courses or less, you would be charged based on per credit hour, which is $549. But if you're a non-resident of Ohio and you're attending part-time, the cost per credit hour is $564. Additionally, 75% of our student population attends full-time, meaning they average 4 courses a semester. And so they are then charged that flat rate of either $6,588 for a resident, and then $6,768 for a non-resident of Ohio. And of course, if you have any questions about the program or enrollment process, you absolutely can get in touch with myself or Regan, and we would be happy to help you. But does anyone have any questions? All right. Well, that works. Well, again, just to reiterate, if you do have any additional questions about the program enrollment process, please write our name down, of course, and then our contact information, and we would be happy to help you. Thank you for joining this information session and have a great rest of your evening.
Thank you.